Hi, I'm Gene McLaughlin. I'd like to welcome you to Let's Talk About. On this program, we talk about key issues facing people in the township and bring you a sense of awareness to what's happening. Today, we're going to be talking about a subject that's not too pleasant, a subject, breast cancer. We're going to be talking about that because this year, 2017, about 250,000 women in the United States will be diagnosed with breast cancer. However, there is an event taking place in May in a number of different communities called Paint the Town Pink. The purpose of the campaign is to create an awareness among women, particularly women over 40, about breast cancer, about the need for early detection, and getting an annual mammography. To help me sort through this today, I'm pleased to welcome our guest, Dr. Campo, who is a breast surgeon. She specializes in breast surgery. She's from the Meridian Healthcare group of hospitals. And Dr. Campo, I'd like to welcome you and thank you for coming out today.
Thank you. Thank you so much for having me.
Okay, if we can get right down to this, Dr. Campo, tell us a little bit about Paint the Town Pink. What is it all about for people who have never heard of it?
Right. So Paint the Town Pink started in 2007, and it started as a awareness campaign for getting women getting their mammograms. So there's Breast Cancer Awareness Month in October, but this group wanted to focus on encouraging women to get their mammograms. So it started out in Red Bank, and each year it started to include more and more towns nearby, and now it's spanning the whole eastern coast of New Jersey. And I believe there's up to 75 towns participating this year. And so now it's expanded beyond just getting mammograms, and it's focusing on encouraging women to pay attention to their health, to keep up with their screening appointments with their primary care doctors and gynecologists, and other treatments like that.
Is this program, Paint the Town Pink, proprietary to Meridian, or is it a broad-based program?
Yes, it is proprietary to Meridian.
It is?
Yes.
Even though there are a number of other programs like this around the country to create awareness,
Yep.
well, all of which has got to help you with your mission.
Yes.
And what is your mission? What are you trying to do as a breast surgeon?
So I treat breast cancer, and then I also see women with other breast issues.
Mm-hmm. And how many women would you say you see? Do you have any idea of women that come in with problems? Or do you detect them? Do they detect them when they come in? If they come in and already detected something and they want you to take a look at it, or do you find something new that you've never looked at before?
So there's a whole variety. Some women come in to see me after they've already had a biopsy showing cancer, and then from that point I help guide them through the treatment process. Other women come in with a new palpable mass or nipple discharge, or even just abnormal imaging, and then we continue the workup to see if this is anything to be concerned with.
What is the, why, let me rephrase that, why does the age for mammography or mammograms keep changing around? It seems to be moving constantly when you read the papers. You should have the first one at 40, 45, 50. What is the standard now?
Right, and that's because the research is continually updated, and also it depends on which organization is looking at the research and what areas they think are considering a benefit to the population. And so we do see a benefit for women getting screening mammograms starting at the age of 40 and then annually thereafter. But then some organizations have found that if you get a mammogram every 2 years, there's less false negative or false
positives.
Yeah, so less benign biopsies and a higher rate of detecting breast cancer. But as a breast surgeon, when I see women getting their mammograms every year, we definitely pick up cancers that had no evidence of being on their previous mammogram.
That's what I was going to say, and they have no outward symptoms, I take it. It doesn't always present as a symptom. Huh?
Right.
You mentioned off the air about 12% of women, correct me if I'm wrong, about 12% of women will be contracting breast disease sometime in their life.
That's correct.
Is that true?
Yes.
That's a lot of people.
It is.
That's a lot of people. You figure 250,000 this year and 12% of women, that's a lot of people. When you look at women, and I'm going to put my glasses on if you'll excuse me so I can read again, the incidence 12% or so, what role does genetics play? If grandma has it, if mom has it, what role does genetics play?
Yeah, so it's a big role. Whenever women come in to see me, I always ask them about their family history of breast cancer and ovarian cancer. And some women are at increased risk just based on their family history. And other women, depending on the pattern of their family history, can sometimes qualify for genetic testing. And if they're found to have a breast cancer gene, their risk of developing breast cancer is very high. It's up to 80%.
Really?
Yes.
Wow, that is serious, isn't it? What can women do, listening to this program, what can they do to help themselves before they even see you? And we'll talk a little later about the degree of compliance in women that do the mammograms. What can they do to help themselves?
So they can perform a monthly self-breast exam so that they're aware of what their breast tissue feels like. And if they notice any new lumps or any concerning changes with their breasts, then they can go to their primary care doctor or their gynecologist to then have some further workup. Also, if they develop any new nipple discharge or just anything that they feel has been a change in their breasts.
Okay, thank you, Doctor. Given all the advances we've seen in technology in recent years, MRIs, PETs, scanning, etc., is annual mammography or mammography still the gold standard?
Yes, right now it is the standard for screening. Really? So far it has been the only type of breast imaging to show a improved survival rate in women in regards to breast cancer detection. There are some other types of breast imaging that do give us great images, but they've not been found to be as beneficial as from a screening perspective. And so the mammogram is always a really good place to start, and then if anything's seen on the mammogram, then either an ultrasound could be recommended or sometimes a breast MRI.
And now there's a new 3D mammogram?
That's correct.
Is that any more effective or more sensitive?
So far the research is still out on that, on whether or not whether or not it should replace just a standard 2D screening mammogram. But it definitely gives great images. It's very beneficial to women who have dense breast tissue because it can see through that density a lot better than just the
3D.
Yeah.
And this would tend to be more younger women, right, with denser tissue.
Yeah.
Let's say a woman is diagnosed with breast surgery. With breast cancer. What's the first path of treatment? Where do you go from there?
So typically they would come to my office first as a breast surgeon, and then I help to guide them on what the next appropriate treatment would be. Most of the time we start with surgery, either a lumpectomy or a mastectomy, but some women do need chemotherapy first.
And how long would that last? And what type of thing would be treated with chemo as opposed to surgery?
So it depends on the stage of the breast cancer, and then also, actually more importantly, is how aggressive the breast cancer is. So sometimes a stage 1 or stage 2 breast cancer could still require chemotherapy.
But beyond that, it also comes to the size of the lesion?
Correct.
That would also indicate what you're going to do with it, huh?
Right.
If you do surgery, as you said, you do a lumpectomy, which can be effective. What % of the time would you say, or could it spread? Do you take a chance with that as a woman, choose that, or do you urge that, or since it's less disfiguring, obviously?
Right. Yeah, it does allow us to preserve the breast, and so typically that can be performed for a stage 1 or stage 2 breast cancer, but it also depends on some other details of the breast cancer. I would say probably about 70% of women could have a lumpectomy.
Really, 70% that high?
Women, yeah.
And you get all of it then, pretty much, and you have some reassurance that all the edges have been,
Right, you have to make sure to get it all out, and then the pathologist looks closely at the edge to make sure everything was removed.
That's interesting. You got to give women a lot more comfort too, I'm sure.
Yes.
Can I ask you a question? Recently, there's been a lot of publicity about a woman like Angelina Jolie, who had a prophylactic mastectomy. Why would she do that, and what is it impacting, or how is it impacting other women?
Yeah, so she had a family history of ovarian cancer and possibly some breast cancer. So because of that, she underwent genetic testing, and she was found to have the breast cancer gene. And so when someone has that gene, they have a risk of up to 80% of getting breast cancer in their lifetime.
Wow.
And for ovarian cancer, it's close to 30 or 40% risk, which is also very high. And so women who have that gene can prophylactically have their breasts removed before cancer has been detected, and that reduces the risk greatly.
Okay, that seemed to have really caught on, though, publicity-wise. It got a lot of press. It got a lot of notoriety on television. Did it draw more women, you think, into doing this or considering this, or did women look at it and say, no way? How did women generally respond to this?
For the most part, it was good. We definitely heard from a lot more women interested in getting the test. It definitely helped to increase awareness about it. And so I often have women coming in to ask if they would be able to get the testing done. It is important that we only test women who are at risk of having the gene, and so we go through their family history to make sure that they qualify for it. Because you can have some inconclusive results, so as long as they fit certain criteria, then they can get the testing done.
Okay, thank you, Doctor. I hate to touch on difficult things, but how about success rates, survival rates, different stages? What's the survival rates?
Yeah, so overall they're actually quite good. For stage 0 and stage 1 breast cancer, the 5-year survival is close to 100%.
Really?
For stage 2, it's around 93%. And then for even stage 3, the 5-year survival is 72%.
Well, that's encouraging.
Yes.
When you see that, and I think you have in your literature someplace that the early detection is the woman's best defense.
Yes.
Against having a problem down the road, against breast cancer. Okay, after you have a mastectomy, what's the next step? Reconstruction? And how difficult is that?
Yeah, so often women will typically be able to qualify for having immediate breast reconstruction, where as a breast surgeon I would remove the breast tissue and then a plastic surgeon would come in to do the reconstruction. Mm-hmm. And then the reconstruction is typically a staged procedure, and they would need sometimes 1 or 2 more operations just to get to the final result.
And this can either be 1 breast or 2 breasts? Or?
Correct.
Okay.
Yeah.
Okay, well, thank you. We're going to talk about PINK if we can a little bit, okay?
Okay.
Tell us about PINK. We talked a moment ago about what it is and what kind of a campaign it is. Maybe we could talk about this year's campaign specifically. Oh, I had one other question, if I may. I'm jumping ahead of myself. What about non-cancer conditions that you diagnose? What happens there? What's the incidence there if you have a non-cancer situation in the breast?
Non-cancer?
Yeah.
So yeah, some women will come in to see me and they have a benign lump, and sometimes I will need to remove that just because it's been increasing in size or is painful. I also see a good number of women who've had a needle biopsy that shows atypia, which is not benign breast tissue. It's not cancer, but it's kind of a gray area in between. Mm-hmm. So often the radiologists and pathologists want to take a closer look at that surrounding tissue. And so I'll just perform a small procedure to do a small lumpectomy, take out that area to see what's going on. There's about a 10 to 20% risk of that atypia being a breast cancer when we remove it.
What is atypia, if you don't mind my asking? How do you define atypia?
It's just something the pathologist sees after they do a biopsy.
Okay. Can this evolve into cancer?
It can, depending on the details of the atypia.
Okay, well, thank you, Dr. Campo. Folks, we're talking with Dr. Catherine Campo, who is a breast oncology surgeon connected with the Meridian Healthcare Group. She specializes in breast surgery. We're discussing some of the risks, some of the damages caused by not having frequent mammographies. We'll be back in a moment. We're going to talk a little bit more about this PINK campaign that we started the program with. Please stay with us. We'll be back in a moment.
Look at you. You're at the top of your game. You're unstoppable. Nothing can throw you off track. Wait, is that your car? Uh-oh. Yeah, I saw that coming. That will throw you off track. You're looking at around 10 grand in fines, legal fees, and increased insurance rates. Let's try this again. Smart move. Because buzz driving is drunk driving.
Your daughter just had her first breakup. Do you A, put yourself in her shoes? B, console her?
Don't worry, sweetie. This is gonna happen a lot.
Or C, find her a new boyfriend?
Nice, single boys. That was weird.
As a parent, there are no perfect answers. But you don't have to be perfect to be a perfect parent. Thousands of teens in foster care will love you just the same.
Everybody has a dream. Mine was to see the ocean. And with a little help, I made it.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But you probably won't. You're busy. Kids, work, show coming back in 48 seconds. So let's do this now. Hold up 1 finger if you're a man, women 0. 3 more fingers if you're over 60, 2 over 50, 1 over 40. If you're not sure, keep in mind you're sitting on a couch right now, so one more finger if you're not very active. One finger if yes, 0 if no. 1 yes, 0 no. Next, find the body type that looks most like you and hold up that many fingers while I look around awkwardly. And that's it. If you're holding up 5 fingers or more, you probably have prediabetes. Sorry to be so blunt, but hey, you're busy. Just go to the site.
Hi, welcome back to Let's Talk About. Today we're talking about breast cancer. And we're going to be talking in a moment about a campaign that's taking place in this township and many other townships across the area called Paint the Town Pink. It's an effort to raise awareness among women, particularly women over 40, to get their annual mammography and to be aware of the importance of early detection. My guest is Dr. Catherine Campo from the Hackensack Meridian Health Group. Dr. Campo, again, thanks.
Thank you.
Dr. Campo, if we can talk a little bit more about the event itself. What does Pink On? I noticed in the literature there's a lot of the campaign Pink On.
Yes.
What does that mean?
So Pink On is the theme for this year for Paint the Town Pink. And it's to encourage women to be aware to get their annual mammogram, but then also to be aware of their overall health and wellness and to do something in addition to improve their health, like going to see their primary care or gynecologist or getting some other type of screening done. Or just helping with their wellness, taking a yoga class or helping themselves to relax.
So that's what you mean when you say you want to have women take the pink a step further.
Yes.
That's the whole idea. Okay. Do you ally yourself with any healthcare facilities or any gyms or anything like this, or do they participate in the campaign?
Yes, so I work for Riverview Medical Center and
Yes.
Bayshore Community Hospital, part
Yes.
of Hackensack Meridian.
Right.
And all the different towns in the area have different events associated with it, Paint the Town Pink.
Okay, that's what I was just going to get to. How does a township get involved? Particularly, I know from some of your literature, you place a lot of emphasis on businesses.
Yes.
What can businesses do, or what do you want them to do?
Right, so they can start by going to the Paint the Town Pink website and to see all the information on there, and then they can pink out their business by
Which means?
decorating the windows pink
Okay.
and bringing other pink things into their offices to help support Paint the Town Pink.
Okay, and I think in some of the towns you have banners
Yes.
that are prominently featured in parts of the town or across the
Right.
streets or whatever.
Yeah, towns can sign up to be part of Paint the Town Pink also, and they can even put pink in their name for the month. And
Okay.
decorate parts of the town pink to help show awareness.
Okay, how about your role, the role of the surgeon, the role of the doctor in this campaign? What do you do?
So often I'll give some presentations to women about different aspects of breast cancer, whether it's prevention or treatment or how they deal with their diagnosis. And sometimes that can be sponsored by the hospitals or by the businesses. And also I attend some of the events myself to help to participate.
Okay, and one other thing I was going to touch on with what you do. What about the role of volunteers? Volunteers important to your campaign?
Yes, absolutely.
To get people out?
Yes, so they help to spread the word about Paint the Town Pink, and the different businesses and towns can have get kits from Hackensack Meridian that with different pink things to help out with their decorations. So the volunteers help to deliver those, and they also help to spread information to their town and to the businesses.
So like any event of this type, volunteers are usually important. I know they are in this township.
Yeah,
volunteers
absolutely.
run this township really in many ways. Okay, how about the fundraising efforts? You mentioned in your literature that you raise money, and you seem to place specific emphasis on raising money to help low-income or underserved women. How does that work? Where do you get your money from in the first place, and then how do you distribute it?
Right, so when Paint the Town Pink started, it started as an awareness campaign.
Yes.
And then people automatically just wanted to help donate money to help out women since they were raising awareness about mammograms. So now that it's continued on to also support women getting their different doctor's appointments and other health wellness, some of the fundraising will also go to that. And so if women are interested in getting funding, they can usually go to their doctor and who can help to direct them how to.
So this would be a lower income woman who could
Correct.
appeal to you, and you could direct them in the right
Right.
area. Okay. Do you, as part of Hackensack Meridian, do you fund with the pink money, do you fund research? breast research at all?
No, we do not with the Paint the Town Pink funds, but there are clinical trials available at the Hackensack Meridian Hospitals.
Really? And how do you get the subjects for that? Do you screen, or how do you gather them?
Yeah, as a surgeon and as with talking with my colleagues, when we have a patient who qualifies for a trial, then we talk with the patient to see if they'd be interested in participating.
And this is on detection, on treatment. At what level do you have these kind of this kind of research?
Right, it's all levels.
Really?
It just depends on what trials are available at that time.
Dr. Campo, I've seen some of your publicity. A lot of the towns get very ambitious in some of the activities. Can you share some of the activities that are taking place this year?
Yes, there's different presentations and dinners and just different events to help get the community together to create awareness.
Because I see things like Girls' Night Out, Breast Friends, pink cocktails, this type of thing. This is
Right.
Each town sort of does their own thing or can be creative.
Yes,
As
yeah,
long
and
as they-
businesses can get involved also.
As long as they thread the pink theme throughout is your goal. Okay. And if I, as an individual, wanted to sponsor something, what would I do?
So the best way would be to contact the Women's Center at your local Hackensack Meridian Hospital. If you'd like to donate money, they can help direct you on ways to do that. And also they have representatives for the towns that can help to let you know about the different events going on and ways that you can volunteer to help out.
Okay, thank you. We have talked about how you handle things clinically, how you handle things financially. But this is a major event in a woman's life, I'm sure, when she's diagnosed with breast disease or a mastectomy. How do you treat women emotionally that are facing this kind of catastrophic illness?
Right, the emotion's a big part of dealing with the diagnosis of breast cancer. So usually that starts to come out with the first visit when they come to my office. So I always give them plenty of time to talk through everything and help to understand what they're going through. And then I have a lot of people I work with who can also help out with the different emotions that'll come out in the following weeks as they're going through treatment.
Given the fact that the breast is such an important part of femininity, women must be shattered, many of them,
Yes.
when they hear this. And then you have to help them overcome this and get their bearings again and look toward what's coming next, mastectomy or whatever, mastectomy and then reconstruction.
Right.
Is that how you handle it?
Yeah.
How do women respond to you generally with this? Do women eventually, the denial acceptance stage, do they accept gradually?
We do see a bit of denial, and mainly that's in women who just have been avoiding getting their mammograms.
Right.
And then when women are first diagnosed, they're quite upset, and so we help them to get through that. And I find that women start to become more accepting when we have a good plan in place. So after all the imaging has been done and biopsies, and we have a good plan on whether it's surgery, radiation, chemotherapy, or hormonal blocking therapy, when they have a good plan and path, no matter how difficult it is, they tend to get more of an acceptance.
Okay, and you, I think if I heard you correctly, you do have a counselor on hand or counselors on hand to help them work through this mentally and emotionally?
Yep, and then we also have nurse navigators who help to coordinate their appointments. They can provide them resources with support groups. So it's a very good resource to help them navigate their way through their diagnosis and treatment.
Okay, thank you, Doctor. Doctor, given your specialization with breast cancer, breast surgery, what is the biggest clinical challenge you face, would you say, right now? The biggest clinical thing that, impacts your practice?
Well, there's several, but I would say that just having women, be aware to get their annual mammogram and be aware of any changes in their breasts and really remember to put their health first. A lot of women are supporting their family and friends and often taking care of everybody else, and so
that's true.
A lot of times they'll put their health second to everything else. So it's important to make sure that they still stay up to date on their screening.
Okay, do you see any technological changes coming? We talked about technology earlier. Do you see any technological advances that would make your job easier, that would aid in better detection, that may succeed mammography?
I hope so, because mammography is not perfect.
Right.
It's right now the best that we have for screening, but it can still miss some breast cancers. So I know that they're constantly working on ways to improve it. 3D mammogram has been great, has really really sees through the dense tissue well, which can be
Right.
difficult for mammograms. They're looking at different protocols for MRIs to see if that's an option. So there's a lot of research going on right now to try to find a better option than just the screening mammograms.
Okay, thank you. And I think you just anticipated my last question, and that was your message to women. What would you say to women? And you just touched on 1 or 2 points. If you want to take a look at the camera right here in front of you, camera 3, and just talk right into the camera, what would you say to women? Bottom line, what should they do?
So I would recommend that you continue to get your screening mammograms and don't forget to put your own health first. If you detect any issues or anything new, then go see your primary care doctor and they can help get you directed to get your treatment.
Okay, well, I want to thank you for being with us today. It's been very enlightening. And folks, this has been a conversation about breast disease, breast cancer, but importantly, it's been about this exercise, this activity that's coming up, Paint the Town Pink. It's going to be taking place here in the township in the month of May. There are many activities. I urge you to stay tuned to the website. There will be events publicized. You will see the businesses participating. So you too should get out and participate in it and listen to Dr. Campo's words of wisdom, particularly you ladies over 40. Take advantage of the technology that's out there now. Get an annual mammogram and practice early detection. As we said earlier, it is your best line of defense. Dr. Campo, thanks again for coming out. I really appreciate you taking the time today.
Thank you. Thanks so much for having me.
Okay, and folks, this has been Let's Talk About for this time. I'm Gene McLaughlin. We'll see you next time. Take care.